Okay. All right. I know that was a very short break, but we have still lots of knowledge to gain today, which is good for, dementia prevention. So I'm going to move to our next speaker. And in the program, it says Dr. Koerte, but unfortunately, she had a family emergency. And we were fortunate enough to get Dr. Leonard Young, who is a medical PhD student at Ludwig Maximilians University in Munich, Germany, who is supervised by Dr. Koerte and Dr. Shenton and Dr. Plesnila. He's using state-of-the-art neuroimaging techniques to investigate the impact of concussions on athletes. He receives funding by the International Research Scholarship, and I will let him take it away, and he is virtual.
Hello, everybody. Yes, my name is Leonard Young, and I hope you can see my slides. If that should be the case, then it would be awesome if I could get a thumbs up. Okay, great. Then I will simply continue. Yes, so I'm excited to present neuroimaging data of former contact sports athletes later in life. And this is a collaborative effort by LMU Munich, which is based in Germany, and the Harvard Medical School in the United States. So this talk will be structured into 3 parts. First, I will quickly go over why this is relevant. Afterwards, I will go into what we already know. And last but not least, I will show what we investigate and how we use neuroimaging to look into cognitive decline in these former contact sports athletes. And here I will present some unpublished research, so stick till the end. So why is this relevant? Why should we care about contact sports athletes? Well, in the entire world, over 400 million people actively participate in soccer. And over 100 million people, 10 million people actively participate in combat sports. And we know that over 1.1 million people play American football. While this is already a huge population, what might be even more important is the societal impact of said population. For example, we know that the last World Cup final was watched by over 1.5 billion viewers. And you heard correctly, that is billion with a B. Moreover, out of all Olympic medals in the last Olympic Games, 30% were awarded to combat sports. And out of the 9 most watched TV events ever in the United States, 8 were Super Bowls, with the only other one being the moon landing. So we see, while this is not only a huge population at risk, its societal impact might be even bigger. So to the question, why is this relevant? I answer, we have a huge population with an even greater societal impact. So what do we already know? We know that every time an athlete hits his or her head, something close to this happens. And if this happens several times, one can imagine what that does to a brain, and as talked about before, even a developing brain. So it is no surprise that we see that there are higher rates of neurodegeneration as cause of death in former soccer players. Additionally, we see higher rates of dementia at every age in former football players. And we see higher rates of cognitive impairment later in life in former boxers. Moreover, I will quickly also mention the neurodegenerative disease chronic traumatic encephalopathy, which Dr. Nowinski talked about previously, and which has not only been associated with contact sports, but we can now also state that contact sports cause CTE, which I think is a great development. And we know that CTE is characterized by phosphorylated tau neurofibrillary tangles, which are located surrounding the vessels in the perivascular space and which are pathognomic for the CTE lesion. And right now, one of the big issues with CTE is that a diagnosis is only possible post-mortem. So what we as a neuroimaging group are also interested in is it possible to diagnose CTE in vivo using neuroimaging techniques? And what are the neuropathological mechanisms that lead from repetitive head impact in athletes to neurodegeneration later in life? So to the question, what do we know? I answer, we know that participation in contact sports is associated with higher risks for dementia. And we know that CTE is associated and even caused by contact sports. So now I will go into what we investigate and how we use neuroimaging to look into former contact sports at risk of neurodegeneration. And the work I'm presenting is part of the Diagnose CTE research project. This research project consists of 170 former American football players at high-risk playing positions and 57 unexposed control participants. All participants are aged 45 to 74 years of age, and this is a diverse, multiracial, and multi-ethnic sample. And the overarching goal of this study is to identify former football players at risk for CTE. So what are our hypotheses? First, I want to present the hypothesis that accelerated aging processes in the brain might contribute to the development of neurodegenerative disease. And here we use a new neuroimaging concept called brain age. And we applied an algorithm of Bashiam et al. To scans from the MRI scans of the diagnosed CTE cohort. And brain age as an idea works like this. We use 11,000 T1 weighted MRI scans together with the respective participant age, and put all of these scans and ages into a machine learning algorithm. The machine learning algorithm is then able to identify image features of the MRI scan associated with the underlying chronological age. And what we are then able to do is that we are able to input MRI scans from the diagnosed CTE cohort into this algorithm and receive an age prediction. And then we can subtract the chronological age of the predicted age and receive a difference between those two values called the brain PET. So the brain predicted age difference. And there have been several studies that concluded that a higher brain PET score, meaning that the predicted age is higher than the actual participant's age, is associated with neurodegeneration. So what are our hypotheses in the diagnosed CTE sample? Our first hypothesis is that head impact exposure is associated with advanced brain age. And our second hypothesis is then that advanced brain age in former football players is associated with worse neuropsychological functioning. So first, we compared the former football players to the unexposed control participants. And we did see that the former football players were on average estimated to be 2 years older compared to the unexposed controls. Next, we see that the football players were estimated to be 1 year older than their actual age with every 4 years of active football play. And as Dr. Nowinski previously mentioned, we also looked at cumulative head impact indices. The cumulative head impact indices are measures of or estimates of the career-long exposure to repetitive head impacts. And they take into consideration collegiate helmet accelerometer data of each playing position and the time played at each playing position And then out of these parameters, 3 scores are constructed. First is the head impact frequency score. So this is the number of head impacts over a career in American football. Second is an estimation of the linear acceleration and force endured over a career in American football. And last but not least is the rotational force and rotational acceleration endured over a career in American football. And what we see, it's quite interesting. We see that it's not the number or frequency of estimated head impacts that is associated with advanced brain age, but it is the estimated linear and rotational force that are associated with advanced brain age. So we conclude that head impact exposure is indeed associated with advanced brain age. Next, we then used the Montreal Cognitive Assessment, or short, the MoCA, as a measure of broad cognitive functioning to assess whether brain age is associated with neuropsychological functioning in former football players. And here we see that the larger the brain PET score, the worse the performance on the Montreal Cognitive Assessment. So we also conclude that advanced brain age is associated with worse neuropsychological and functioning in former football players. And as underlying hypotheses, we now conclude that head impacts influence MRI visible brain structure associated with advanced brain aging. And as another hypothesis, we have that repetitive head impacts might impair brain clearance. And here, Dr. Fraser briefly mentioned a new brain clearance pathway that was first described in 2012, called the glymphatic pathway, which is hypothesized to be a convective flow network from the perivascular spaces surrounding the cerebral arteries, seen on the left-hand side, which drive cerebrospinal fluid by arterial pulsation through the interstitium and remove cerebral waste into the perivenous pathway. So what I want to show with this picture is that the perivascular spaces are potentially an essential part in clearing the brain of waste products. And we know that in neurodegenerative disease, larger perivascular spaces are prominent. Additionally, larger perivascular space volume have been shown to quadruple the risk for vascular dementia later in life. And we've also already seen that mild traumatic brain injury is associated with larger perivascular space volume in veterans. So what did we do? We quantified the perivascular space volumes based off MRI scans of the diagnosed CTE research project. And this produces this perivascular space map, which you can see in the middle. And out of this, we calculated the perivascular space volume per brain. And we then calculated a percentage of perivascular spaces per brain. And we then calculated the logarithm of set fraction to better fit statistical normality. And again, our two hypotheses were, first, that head impact exposure is associated with larger perivascular space volume. And second, that larger perivascular space volume is associated with worse neuropsychological functioning in former football players. And again, we looked at the cumulative head impact indices. And a similar picture, as seen in brain age previously, unfolds. First, we see that it is not the number of estimated head impacts endured over a career in American football, but it is the estimated linear or rotational force that proves to be significant with the perivascular space volume. So we again conclude that head impact exposure is associated with larger perivascular spaces. And we again looked at the Montreal Cognitive Assessment as a measure of broad cognitive function. And again, we see that the larger the perivascular space volume, the worse the performance on the Montreal Cognitive Assessment. So we also conclude that larger perivascular space volume is associated with worse neuropsychological functioning in former football players. And all of that leads us to the conclusion that larger perivascular space volume might suggest impaired brain clearance that could be associated with neurodegeneration in former football players. So, in the end, what we investigate is we investigate new neuroimaging methods to detect cognitive decline in former contact sports athletes. And here I presented two differing hypotheses, with the first one being that former contact sports athletes show larger brain age compared to the unexposed control participants. And as a second hypothesis, that former contact sports athletes show larger perivascular space volumes compared than unexposed control participants, which could be indicative of impaired brain clearance. And last but not least, I would like to thank all of you and would be happy to answer any questions. Thank you very much.
Thank you very much. Are there any questions? Charles?
Can you hear this question?
Yes.
Good. How long does the increased perivascular space volume take to develop after repeated head injuries? And was it still present at the time the neuropsychological testing with MOCA was done?
So first and foremost, thank you very much for your question. And so right now, this is still under investigation, what the exact timeline is of perivascular space enlargement after concussion or repetitive head impact. So this study was cross-sectional and was not directly after a head impact, but in athletes that had 20, 30 years after their active careers. And the MRI scan was performed at the same day or same week as the MOCA. So in this study, we cannot actually say anything about the development and whether it was directly after the Korean American football or when this development occurred. But what we can say is that it was present at the time that the MRI scan and the neuropsychological assessment was performed. On another note, we also look at adolescent soccer players. And here we see that the perivascular space volume usually decreases in children over time. And we see that this happens with athletes that are not exposed to repetitive head impacts in a normal fashion. However, we see that in adolescent soccer players that actively train to head their ball, that the perivascular space volume stays on a consistent level. So it does not perform this physiological decrease in aging or in adolescence. So this could potentially hint at processes happening directly after the head impacts and not in the stretch afterwards.
Thank you. Any other questions? Actually, while I wait, I'm going to ask you a question. So this is great to see because, I love it when results all converge. And we have similar results to you that show that actually repetitive head injury in these former athletes had this kind of accelerated aging effect. But we did find that certain parts of the brain seem to be more vulnerable than other parts. Like it wasn't across the whole brain, like a global phenomenon. Are you finding that also?
So this is actually something that we're looking into right now. So the parameter that we used for this manuscript, which is currently under review, is a global parameter. So it just takes the entire brain and estimates the age. But what we are now looking at is CTE specific regions, which we see in the neuropathological analyses to be associated with CTE, and try to only look at the aging in these specific regions and possibly be then more specific to CTE and hopefully be better at finding or detecting those with potential neurodegeneration in the long run. So I don't have any results on that right now, but yeah, I would be happy to come back and present those another time.
Yeah, great. Thank you. Any more questions from the audience? Yes.
Hello, hi. So I just want to ask if you looked for DNA methylation and epigenetic on your study or no?
Sadly, there were no epigenetics or methylation performed in these participants in context to our aging parameters. But the algorithm that we used has previously been associated with other parameters of aging and did show significant associations. But of course, this was not in a sample that was exposed to repetitive head impact.
Thank you. Any other questions? The audience? Yeah.
Thank you for that talk. I wasn't clear on in which sample you looked at the relationship between the nature of the forces at injury and your outcomes.
So this was, yeah.
Go
So
ahead.
we the studies, although the results that I presented were both part of the Diagnose CTE research project, which is across has right now only cross-sectional data available. And here we then compared the MRI scans to the exposure metrics, which used the self-reported playing position at each career level of the former football players to estimate the head impact exposure over their entire career.
And how did you estimate the particular? I thought you specifically said that with particular forces and rotational forces, you had poor outcomes. Did I?
Yes,
Understand.
exactly. So it is only an estimate. So I don't want to claim that this is now the exact representation of each participant's head impact exposure over a career in American football. But what they did look at is that they took all the helmet accelerometer data that was available of athletes at differing level, at high school, at college, and then looked at the accelerometer data that was available for each playing position. And then one can calculate the years of active play at each playing position at each level. So you look at high schools, then at collegiate athletes, and then also at professional players. But sadly, the data for professional athletes was not available. So we used used the collegiate data. So this is rather a lower estimation rather than so this is more an underestimation rather than an overestimation of the head impact exposure over a career.
Got it. Thank you for explaining that.
On ours.
Oh, another question over here.
A practical question. What is the safest position in football and what are the most dangerous positions?
Well, I would say the safest position is on the sideline and probably afterwards, probably the kicker or the punter. But from the active positions, there's not yet a clear consensus, I'd say. So there's still an open or an ongoing discussion on whether it is the continuous repetitive head impacts that are commonly seen in the lineman, compared to the 1 or 2 very big high impact concussions that are seen in wide receivers or running backs or safeties or cornerbacks that sometimes get those very big hits when they try to directly after they catch the ball. So there's no consensus yet which of these are worse. And the quarterback is also at risk because they often get this notorious blindside hit where they cannot really prepare for the hit and therefore cannot activate their neck muscles and others to dampen the impact. So there's no clear consensus on what is the best position, but we can say that no position is better than any position.
Any other questions? I'm just going to make sure there's nothing online. I do see one. Dr. Teal is asking for any scientists here. I'm not an academic, but is there a better screening for cognitive decline than the MoCA? It seems CT more symptoms than mild cognitive impairment.
Yes, that is totally correct. And we did apply other neuropsychological assessments as well. There was a huge battery performed, and we did see other significant associations between both the brain age estimation and the perivascular space volume with other parameters. However, I try to use the MoCA for most of my talks because I think it is a test that rings a bell with most physicians. And therefore, I think it does not need a lot of explaining as some of the other neuropsychological tests do.
Thank you. All right. Well, I guess any other burning questions? Okay. Well, thank you so much. And thank you also for stepping up at the last minute. So we really appreciate that.
Thank you very much for the opportunity.